Hi, I'm Lisa Watson. I'm with Autism BC, the regional coordinator out of Kelowna, and we're very fortunate today to have Tammy Thielman of Town and Country Counselling just outside of Salmon Arm with us today to talk about a very important topic, self-care for caregivers. I'm sure most people out there have felt the effects of COVID, and if you're a caregiver of a neurotypical child, it's tough. If you're the caregiver of a child with a disability, I think it's an added stressor as well. It just makes things a little bit more difficult. So Tammy Thielman is here to talk to us today about some things we can do to increase our self-care or improve our self-care during this challenging time. So Tammy, thanks for being here today and taking the time out of your schedule.
Thank you for having me.
That's great. Thank you. And I'll get you to just do a brief introduction, if that's all right, of yourself and maybe how long you've been practicing and a little bit about your farm.
Okay, so my name is Tammy Thielman, and I'm a registered master's level counselor. I have my own private practice, and I specialize in a few different counseling approaches, but one of them is equine assisted counseling and also animal assisted counseling. And I do that here on our farm, which is set out in the country. It's really peaceful and quiet, and there's lots of trees around. So it's something that is very, near and dear to my heart to connect children who have some exceptional needs and abilities with animals.
That's awesome. So my cat has just entered the room right now. So
okay, they somehow know, right?
We have a photo
That's
bomb.
wonderful. There you go. We talked about the animals, and one appeared.
All right, so that's the first question. So I think a lot of families are feeling right now is, how do you even find the time in your busy schedule for self-care? It was tough enough to begin with. Now we're in pandemic mode. Caregivers, moms, dads, guardians, they're parenting, they're homeschooling, they're still trying to work. How do we make sure we keep our mental health, keep healthy mental health wise?
Mm-hmm. Well, self-care is so important for parents and caregivers, whether it's grandparents or foster providers or, family members who are helping out with children. I think, my heart really goes out to parents of children living with autism because they're working so hard already, and they're often, when I meet them, really exhausted and wondering what can I do. And I like to work with the family as much as I, try to work with the child. And building in some self-care into your day is so critical for your overall mental health and wellness. And my sort of approach, because as a parent of three, my children are neurotypical, and I was still a very tired, busy parent at times, right? And so I understand that living with children with autism, that's going to add an extra layer of stress and, demand on a parent's sort of energy level. So what I always suggest is, and I do this myself, is, build in small steps throughout your day. And it may not look the way you want it to. I think we kind of get bombarded with a lot of images of, having a wonderful home yoga practice and then decluttering and then doing all these things. And it looks really good like in a magazine. It doesn't have to. Just doing little bits as you can throughout your day. So maybe it's as you're doing dishes, you're just being aware of your breathing. When you're with the children, can you take them outside, even just on the porch for a little bit or just out in the yard? You don't have to exercise when you're out there. I think we get a lot of pressure, and we put a lot of pressure on ourselves too to kind of do things a certain way. And it can be really simple, free, low cost, and just little steps. And overall, we get into that habit of bringing some intentional self-care into our day.
Right. No, that sounds great. I'm just going to close the door here for a second.
You bet.
The cat busted in, and then I can hear the boyfriend talking on the phone. So,
Well,
um,
here, my husband, I'm up top. We have a ski shop on our property. We live on a ski hill, and it's closed down right now. But this is where like for the summer, this is where the Wi-Fi is the best. So I'm set up in our shop, and then we have a sawmill. Our mill yard is just across the parking lot, and he was running a chainsaw like really loud. So I had to go up to like, please don't run that right now.
what ski hill are you on?
Larch Hills. It's a
Okay.
cross-country ski area.
Oh, very cool. So, okay.
Yeah,
Yeah.
there's trails and a chalet and everything.
Awesome.
Yeah.
I think that's really important what you say, that it doesn't have to look a certain way. And we all think,
Yeah.
I need to do 20 minutes of yoga, or, I need to do this.
Yes.
And I know one of the most important things that my own therapist has said to me is
Yeah.
just remember to breathe, right? Sometimes
Remember to breathe. Breathing, right. Yeah.
breathing is really important.
Something that children and I often do, just pull in a breath. Our bodies, our autonomic nervous system will keep us breathing. It'll keep us alive, but it won't keep us breathing and relaxed. So just paying some attention to your breathing. Could you deepen your breath a little bit without forcing it? Could you extend your exhale a little bit to lead to some relaxation? And then return to normal breathing and what you have to do. Maybe in the next hour, check in again with, are you actually breathing fully? Or are you breathing really shallow and rapidly, which is actually creating more tension or keeping it there? So just having that awareness and checking in with that throughout the day can be huge.
Yeah. And I think, I just, a few things that, she said to me is like, it doesn't have to be perfect. And,
Right. Yeah.
I think we have such high expectations. It's the pandemic. We should learn a new language. We should
Yes.
declutter, like you said, and be kind to
Self-improvement.
yourself. Be kind to yourself.
Yeah. Speaking another language, like you said, or, doing something really big and sort of working on our self-development. And the way I view that is that, we're not projects, we're people, and we're thinking, feeling human beings, and we can, maybe give ourselves the grace to accept ourselves the way we are. And just my motto, little steps. Little steps. Parents have so much pressure on them already. And, many children do as well. So if you feel like you're just sort of surviving the day, kind of getting through by the edge of your fingernails, you don't need more pressure. And the last thing I ever want to do is put more pressure on parents and children. So just gently building in a few moments throughout the day.
Yeah, and I like that realistic approach because as a caregiver, my son's 15
Okay, yeah.
and he's autistic as well. And I know when we've had therapists in the past with different therapists, speech therapists, occupational therapists,
A lot of
a lot of
appointments.
a lot of appointments, and a lot of times, it depends on, we've had amazing ones where they're very realistic and they realize that we're a parent and we're not a therapist. And by the end of the day, we're pretty tired and we don't have the energy to practice particular exercises or things that they'd like us to work on. So I think that's a realistic approach for yourself. Like, you're not looking at adding more work onto a family, because I think sometimes that's what people think when they think about therapy as well, is, if I'm going to go see a counselor or a family counselor, like, how much more work is that going to mean for me? So that can be
Absolutely.
daunting.
Yeah. And I do hear parents express that they say, we have a lot of appointments already. I'm really tired. How are we going to do this? And I'm grateful that I can try to reassure them that, what, therapy can be work. It can also be rest. And that's one of sort of the core approaches of my program, is that it's about being with the animals, not doing with the animals. So it's not performance-based, it's not task-based. There's learning, but it's very self-directed, very gentle. And I mean, I think approaching self-care in that way can also be really valuable in that you can relax into it. It's not sort of a task driven, exercise where there has to be an outcome, if that makes sense.
Yeah, no, that totally makes sense. That's a good segue into one of my other questions. If you can
Okay.
talk maybe about the animals that you do have and about the equine facilitated therapy that you do have as well, because I get a lot of questions from families about
Okay.
equine therapy. I do know we have a few organizations here in the central
Hmm.
Okanagan that are doing it.
Okay.
But I don't know enough about it. So
Okay.
any information you could give would be great.
Sure. So there's, a kind of a few different terms that are often used interchangeably. Therapy, counseling. I mean, I use those kind of both myself, but I'm a regulated counselor with ongoing specialized training in equine therapy and animal assisted therapy and some other areas. So what we do here is equine and animal assisted counseling.
Okay.
And like I said a little earlier, my program, it's all about being with the animals and helping the child or youth that I'm working with really get into a place of rest in their nervous system. There's so much pressure on children and families and youth, especially right now that, I don't want to add any pressure. So they come here, we go into the corral near the horses or the animals. I have a cabin, so it's a very non-clinical sort of office setting. And we can stand out in the trees or out in the shade with the animals. And that's how we have our sessions. And it's about being with the animals, learning a bit about them. And so much of it is very individualized to the child or the youth that I'm working with. One of the wonderful things about connecting children and animals is that there's such a wonderful connection between them. And, even if the child just really wants to sort of be by the horse and not really put hands on them, that's okay. We can go with that.
That's
Or if
fantastic.
they, yeah, if they want to be a little more active and lead them around a bit or brush them, we can do that as well. And depending on the age of the child, it's often very play based. I have, some different toys and things that we can do, or maybe it's, they're playing with leaves or playing with some sticks, or we're sitting on some logs and watching the horses. So there are so many things that we can do within an animal or equine assisted session. It's really wonderful.
That's fantastic because I think a lot of families too, especially with younger children, they think, what does counseling or therapy look like for my child
Right.
if they're not cognitively able to,
Absolutely.
sit and interact, like and
Yeah.
vocalize what they're feeling. So
Yeah, and most of the time, in my experience, I can speak for myself. Is that's not what children want. They really want the pressure off, and they just want to play or to interact, kind of at their own pace with the animals and with me. And yeah, it's really wonderful to help facilitate that.
what would you say to a family? Because there are a lot of kids that do have some fears of animals. Would you say it's worth for them to give it a shot? And how have you seen? Maybe do you have an example of perhaps a child that was fearful of animals and how you approached it?
Yeah. So I always try to, check with the parents and meet with the parents first to get an idea of, what their child is like and what they're hoping for from counseling, what they sort of expect. They may have questions and they can tell me about their child. If their child is not sure about animals, I have a little bunny who's really fuzzy. His name is Snowball. I also have some little toys. I have little toy horses and different animals, and we might just start sitting in the cabin, depending on the age of the child, maybe playing with some Play-Doh or slime or looking at the little toy animals, and maybe one of the horses is just out in the corral. And then gradually, as the child expresses some curiosity, we can approach the horse on the child's timing and they can get to know them or maybe they want me to go there first and just pet the horse and role model that. So it's very individual. And if a child's not comfortable, that's okay. We can, just focus maybe some more on doing some ecotherapy. So just being outside in the sunshine, or, going for a little walk, maybe looking at the animals from a distance. So I try to make it really flexible, and usually eventually we get there. The children and youth, they want to sort of go and meet the animals and get to know them a little bit.
That's awesome. Getting back to the self-care a bit for the
Yes.
caregivers, you're a mom of 3, you mentioned as well.
Yes.
So, and so you're familiar with, caregiver guilt or mom guilt. So what would you say to a mom, or how do you work on making sure that you take the time for self-care without feeling any bad feelings about it? So why is it so important?
Right. Well, I think I would be much easier on myself now. Now, 2 of my children are adults, and our youngest is in her mid-teens. So when I think of, how hard I was on myself as a mom of 3 younger children, I was like, oh, I would tell myself things so differently now. And I think probably be much, much more relaxed and able to enjoy self-care. I think a really important piece with self-care is we may not have been shown self-care. It's kind of maybe a bit of a newer idea, depending on, where we come from, what we were shown, role modeled, what we were taught. So many of us are learning self-care as adults, and that can be challenging.
Yeah, I agree, because if I look back at my own childhood, I don't think there was a lot of self-care practice from my parents as well. And I think we're just in such a different mindset now, where there isn't the stigma around seeking help, or there shouldn't be the stigma around seeking help for
I think
counseling.
it's getting better. I hope so.
Yeah. Yeah, and I try to be vocal about that with families when I'm talking to them. I broke in the summer and mentally, and I had to start seeing someone, and it's helped immensely, just to have that. Yeah, to have that extra person there, that's neutral. So
Yes.
I don't think there should be any judgment, and I think people should be applauded for seeking help and checking in and taking the time for self-care for themselves as well.
Yes, for sure. One way I sort of put it, it's an image that kind of resonates with me, and I can break it down to help, communicate how vital self-care is, how most of us, have cell phones, and how low do we let our battery get in our cell phone before we plug in our phone and recharge it, and we can see the charge going up. And if you kind of picture your own level of energy, kind of like a cell phone battery, is it at 10%? Is it at 0? Do you need to plug in and boost your energy back up there to 90% or 70? Where is that gauge for you? So the more we can get in touch with where our energy level is at, that helps us to know maybe what little things we need to build into our day to help boost our energy back up. Often, parents are giving so much. We need a little something back. Maybe it's just having a cup of tea, leaving the dishes, which will wait, so you can sit down for a few minutes. Maybe it's letting, the children use the iPad a bit longer than you'd really like to, or, watch another show on TV, so you can just have that time to, decompress.
Yeah, and I think be kind to yourself, like you said, and
Be kind to yourself. Yeah.
none of us have ever lived through a pandemic before, so to add that added stress on to already taking care of children and taking care of children with disabilities.
Absolutely. And for so many parents, trying to do multiple things at home, and that kind of highlights, the many multiple and often conflicting roles that we have. We could be employees or business owners, and then we're parents, and we're spouses or partners, and there's so many different roles that we can occupy that all have demands. So I always kind of say, bring it back to yourself. What do you need? What are you sort of feeling or noticing? What do you need to support yourself? Maybe it's just, a few minutes outside with a cup of tea or hot chocolate, or allowing yourself to play Play-Doh with the kids for a while. You
Mhm.
know, um, I also like to sort of break down self-care into, you know, free things maybe that you already have in the house, um, to, maybe up to $10, because I realize that finances are often a real barrier to self-care. So, maybe many of us would love a big holiday in Hawaii for a week. That can't happen, but we can, throughout the day,
Yeah.
make sure that we're feeding ourselves when we feed the kids, or we take that time to have, a cup of tea to ourselves. I know I keep mentioning tea. I'm a tea drinker.
That's okay. I'm a wine drinker, so mine's like but a cup of tea and a shortbread or something like that works
Yeah,
as well. So,
yeah. And if the
and
kids happen to be playing outside, just sit and have some quiet time while they do that. Don't feel you have to sort of be doing all the time. Self-care can be just enjoying that unstructured time.
yeah, no, and one of our colleagues was writing a blog this month about self-care. And one thing she did say that resonated with me is their family takes an hour every day to do something that isn't purposeful and just
Wonderful. Yeah.
it could be, she said, it could be herself playing piano or just going on the computer and
Right.
just having some time. And I think for myself it comes down to, I think I'm pretty decent at self-care. I think you know as opposed to when I talk to other families that and especially if they have multiple children and they're just you know running, right?
Yes, for
um
sure. Yeah, running, kind of
yeah,
that feeling of running all the time. And
yeah,
so what I encourage, and I absolutely, understand how hard it can be, is there any little time, maybe it's 30 seconds, where you can just be a little stiller for just a little while? And,
yeah,
so much of it is dependent on the ages and needs of children also. But that 30 seconds can grow into maybe a minute and a half, 3 minutes, maybe one day half an hour goes by and you've had a chance to just look after yourself for a little bit.
yeah. And I think, yeah, for sure, like for myself a lot of times it's reading, right? But
Yeah.
um we always find that as a mom, you're sitting there and you're like, how much time can I take to do this reading, right? So, and I
Yeah.
find for myself to sit still is really difficult because I'm
Yeah.
constantly wanting to get up and, I should switch the laundry, or
Right.
to force yourself to sit there and read a chapter.
Yeah.
It's tough, but it's
Yeah.
valuable.
Yes, for sure. And I think the more our nervous system gets used to, I mean, we're creating a new habit. So the more we get used to small amounts built in through the day and noticing the benefits of that, then
Hmm.
we start to want to do that.
Yeah.
Yeah.
What would you say? Because I know
Mhm.
sometimes when I'm doing, like, if I do a yoga
Right.
exercise, it's about 10 minutes or so. I'll
Okay.
use an app, and thoughts are constantly coming into my
Yeah.
head. And I know that the therapist that I see had mentioned, that's okay, like that the thoughts are coming in, but you just need to kind of like be able
Allow
to,
them.
yeah. So what would you say to that? Like, would you encourage writing down your thoughts as they're coming in? And
Mhm.
how do you quiet your thoughts, or how do you
Right.
acknowledge your thoughts?
Well, I mean, there's many different approaches, and of course, it's very individual. So, what works for one person may not work so well for another person, and that's okay. But some of the approaches I would maybe suggest, you could explore, or anybody could explore, would be allowing those thoughts. I like to use visualization. So, maybe you can picture a river flowing or a little stream flowing off to the side, and that's those annoying thoughts. And if we try to stop them or block them, the water's going to build up, but we're just going to allow it to run by.
That's
And
interesting because
really,
that's what I was trying to
yeah,
do. I picture a little flower and the flower floating away.
yes, for sure. Yeah. Or, putting your sort of annoying thoughts on a cloud, letting it drift away while you continue doing what you need to do. And again, we'll eventually get more and more used to that,
Mhm.
and it will become usually easier with time, with practice. Another, suggestion, a person could try would be sort of grounding through your five senses. So, realizing those annoying thoughts are there. You wish they weren't, but they are. You're just going to allow them as best you can. Focus on your breathing, and then checking in with each of your five senses, what you notice, what you're feeling, what you're seeing, hearing, tasting, and seeing if that helps you just stay in the present moment and do what you need to do while those thoughts kind of flow by.
That's interesting because I just picked up the book 52, I think it's 52 Lists for Calm. And the second one is creating lists about just sitting there for 5 minutes and what are your senses experiencing right now?
So, just noticing. Yeah, noticing, checking in helps us ground to the present moment.
I'm just seeing where we're at here. Any any favorite books or any resources that you would recommend to families or parents that or your go-tos perhaps when you talk to families?
Okay. I really don't. I try to individualize it so much for each family or person. Some of my favorite organizations are Canadian Mental Health Association has a lot of good online resources, and you can go to their website and just explore around. Same with Anxiety BC has a lot of really valuable resources. And then Autism BC. I found that there's a lot there. It seems to be a really strong, active, positive, inclusive community. And that's another aspect of self-care is, sort of leaning on your community. Who do you have? A lot of people say, well, I don't have really anyone, or, there's only one or two people who can help me. And it doesn't have to be a big group. But if you have one or two people, how can they help you out a little bit if they're willing to? And are you able to accept that help? It can be so hard to accept it when it's offered.
That is a great point as well. It is very hard to accept help because we try to be independent, and it's challenging, and it's humbling to accept help. And I was at the point last summer where I did have to accept help, and from a friend who, can I come over? Can I help you with something? And yes, you can. Right. So, but it's hard to say those words, right?
It is, for sure.
And it's also hard to say the words no, right? When you're getting all these demands put on you, and to say no to people. And I'm learning that one as well.
Yeah. And
no, that's not going to work for me. I'm sorry, but.
Yeah. I did have a little note jotted down when I was preparing for this about how important boundaries are. And this could be another whole, sort of thing, right? But how important healthy boundaries are when it comes to self-care, and saying no is, I think, really a very critical part of self-care. Realizing, what are your boundaries? How do you look after yourself and your family, and what your needs are? And that can include saying no to some things. I mean, I have some families who they will inquire with me about counseling, and it's not the right time for them. They have so much going on, or so many other appointments, and that's okay. They know it's not the right time for them, and I completely respect that. So, it is okay to say no.
That's good to hear, coming from a professional as well. So, and I find sometimes people are afraid to say no because they're worried about what the reasoning is going to be. But what I've experienced myself is, if I say, no, I'm sorry, that isn't going to work for me, or I can't attend, most often people won't follow up and ask you why.
Yeah.
And, it just doesn't work for me. Right. So,
right.
I think that's kind of what we wanted to touch on today. So,
okay. Awesome.
Yeah, I think it was really good. A couple of questions that I do have for you. You probably see a lot of families. I'm assuming you are able to take autism funding?
Oh, yes. Yeah, I am an autism funding provider. I'm registered with them.
Okay. Yeah. So, because I have a North and Okanagan email list as well. So I'd love to share your information with the families in that area. So, so I think, I think that was kind of what we wanted to touch on. You need to take self-care. So besides tea, what do you do for yourself?
Well, I spend a lot of time with my animals. I do. I've really had to sort of, self-care for me has been a process of learning, right? Especially as I've, expanded my sort of professional skills and learning and awareness. And I've really tried to give myself a bit of a break in terms of, doing things I enjoy. I really love to just go and play and have unstructured time with my animals.
Awesome. So yeah, and I think like right now, like just kind of like speaking without the recording, but
Sure.
I think families, like people are finding a real tough time with having boundaries between work and home because you're working from home, right? So,
Right.
I've tried to shut off more like, okay, 4 o'clock comes, 4:30 comes, I'm not answering any more emails. Whereas in the
Absolutely.
past, I
Yeah.
was pretty bad about that or
Yeah.
not great with it. So,
And
um,
there's a really good boundary. And having a private practice, I can share that where you might drift off to sort of doing some work kind of after hours or
hmm,
yeah, I think it's important to have that awareness and have those boundaries. And maybe it, and boundaries can be flexible, so you might decide one weekend you're not going to check any emails. There might be another weekend you kind of have to check
yeah.
once or twice, and that's okay to choose and change your mind.
Yeah. Yeah. It was interesting because last weekend I had said to my colleagues, I'm not looking at my computer this weekend. And,
Right.
um, just FYI, not going on. And then this weekend, I do know that I'll be sitting in on a workshop, and that's fine with me. But,
Right.
just kind of, yeah, it can be a slippery slope, I think, if you're
It
working from
can
home
be,
too. And,
for
you
sure.
constantly, I try to put the mute on my computer so I don't hear the constant bing.
Good idea. Good idea.
But
There
yeah,
was
no, been a great interview. I think that's lots of information.
I
So
really enjoyed it. There was one thing I just wanted to add, whether you use it or
sure.
not.
Yeah, go for
Up
it.
to you, but I was going to mention, over the years, some people have asked me, like, where do I get resources from? And I have some different handouts and things, and there is so much online.
Hmm.
I've found over the years a lot on Pinterest and
Okay.
just Googling. You can Google free self care template or, free self care PDF. So, and then just look at images and, up will pop a bunch of some are really, more structured, others are really creative. You can color, and there's a huge variety of, free resources out there. If you want to print off some self care templates, or self affirmations are another nice, simple thing to do. You can print some off and cut them out and maybe, look at an affirmation every
Hmm.
day. You can do that with your family, with your children. And, it's, if as long as printing them isn't a barrier,
Yeah.
then yeah, there's actually a lot of free resources out there that you can just allow yourself to explore.
Yeah, and like I said, I think self care doesn't have to be expensive. It can be something as simple as having a cup of tea, or doing a jigsaw puzzle, or just
Right.
sitting on your patio and
Putting your
breathing.
feet up. Yes, sitting on your patio and breathing. Yeah,
It's
absolutely.
amazing the power of sunshine. It's overcast and rainy here today in Kelowna,
Same.
but yeah,
Yeah.
but the way your moods improve with the sunshine for sure. So
It's
yeah,
some
I think for myself when I was going through a rough time, just
Mhm.
hearing someone say, "I'm sorry that that happened to you," or "I'm sorry that you're going through that," like you
Yeah,
know, I think as humans we want to solve things, and there aren't always solutions to these things, or we
yeah,
can't always help, but just to
yeah,
hear that I'm here if you're if you want to vent, for you to
yeah.
listen, and I'm sorry that's really sucky that you had to go through that. So
And
yeah.
let other parents go through it. And, so often when we get stressed or kind of reach a crisis point, it's kind of multiple things happening at once. It's usually just never one thing. It's a whole
Yeah.
bunch of stuff in there. I call it a crunch time. And we
Yeah.
kind of get caught in that crunch. And just to have another parent say, yes, like my child did this, this, and then I did this, and this happened. You go, oh, okay, I'm not the only one who, you
Yeah,
know,
exactly. Other people that get it, right? And
they
yeah,
get
it
it.
might be a different circumstance, but they can still empathize with you. So,
Totally. Yeah.
Tammy, thank you so much for speaking with us today. We really
Thank
appreciate all of
you.
the information that you provided. And I think our takeaways is self care. Everyone should do it. It's very valuable, even if you think you don't have the time for it.
Just
Um,
build in little steps. Yeah.
Yeah, so Tammy Thielman was with us today from Town and Country Counseling, just outside of Salmon Arm, where she practices. And if anyone has any questions, we'll be sure to post the links for her contact information as well. So thank you so much, Tammy.
Thank you very much for having me. It was really great to see you and talk with you. Thank you.